So my name is Daisy Ortega, she, hers, or Aja. I serve as Managing Director at of Training Capacity Building at Health Resources in Action. We are the HRIA, otherwise known, is the host of the Community Health Training Institute, which is a partnership between us and the Massachusetts Department of Public Health, which has brought this training to you for free, and not just today, but certainly the second part that's happening next week. So just want to welcome you all for being here today. So the title of today's training is Deconstructing Structural Racism through Policy Systems and Environmental Change. So you're bound to walk away or leave today with a lot of important information, some strategies, and more so that will be carried through in the second session. Before we turn it over to our facilitators, I'm going to have the rest of the Community Health Training Institute or CHTI team introduce themselves. So I'm going to turn it over to Victoria, if you wouldn't mind bringing yourself in this space.
Hi, I'm Victoria. I'm the administrative coordinator at CHTI, and I'll be running tech today. So if you have any questions, feel free to message me. And I'm excited to be here with you all. And I'll pass it over to Paula.
Hi, everyone. My name is Paula, pronouns are she, hers, and I'm a program associate here at HRIA. I will also be helping Victoria run tech, and I'll be monitoring the chat so that all of your questions are addressed. And I'll pass it over to Mo.
I think we're going to pass it to Lauren. Yeah, is that okay, Mo? All right, we'll pass it off to Lauren. You'll introduce and get us started. But yeah, thanks again, everyone, for being here.
All right, thanks for the introduction, CHTI team. Welcome, everyone. It's great to see some familiar faces and to welcome some new faces. Maybe new to me, but maybe not new to the CHTI programming. So welcome. We're glad that you're here for Deconstructing Structural Racism through Policy Systems and Environmental Change. Just to get us started, I'll just introduce myself and then hand it to Mo to introduce himself, and then we'll be underway. So my name is Lauren Bard. I use she, her pronouns. I work here at Health Resources in Action on the training and capacity building team. I'm a trainer. I mostly train in our youth worker training program and our opioid overdose prevention and rescue program. But I'm really happy to be here today with Mo talking about this topic. And so yeah, I'm a lifelong youth worker in the city of Boston. I'm also a social worker, and I'm sure that I'm going to learn as much as you all will today. Just humbly here to help guide this process. I'm white. My ancestry is from Europe and Canada, and I just think it's important to name that and to bring race into the space. I'm certainly not here because I know more than anyone else, but I'm humbly here to learn and just guide the process. So with that, I'm going to hand it over to Mo to introduce himself.
Thank you, Lauren. Good morning. I'm Mo Barbosa. I serve as Senior Director of Community Engagement at HRIA in the Health and Racial Equity Cluster, and happy to be at home with my TCB friends and family, and here with CHTI. I rock he, him, his. I'm Cape Verdean and identify racially as Black, African, and really excited about being able to be in this conversation with folks, and looking forward to learning with and from you all. So I'll hand it back to Lauren.
Thanks, Mo. So we are going to be presenting some information, but also asking you all to share and participate. So I just want you to locate that unmute button because you'll be invited to share in the space. Also, it's at the bottom left of your screen. There's start and stop video, which you are aware of, I think, familiar with. If you can be on camera, we love that, but we know it's not always possible. There's a chat feature, so if you want to contribute to the conversation or ask questions, drop those comments in the chat, and we will bring them into the space. And of course, the raise hand function will help us, call folks in who want to share something. So we just really want to encourage participation, but we will be also using breakout groups just to get conversation going. So we'll do some talking in the beginning, and then we'll get into the more interesting stuff where folks are sharing. So with that said, the learning objectives, this is what we're hoping you're going to walk away with today, being able to define structural racism and the systems that perpetuate it. identify tools to address health and racial equities through policy systems and environmental change through that framework, and examining our own personal biases and privileges as they relate to structural racism and other systems of oppression. So we can go on to the next slide. I just want to talk about the integration of the head and the heart. So, we've got two ways of processing information, and there's head knowledge and there's heart knowledge. And I think that head knowledge is, data, joining a book club, really learning the facts and figures. And I think this is a very comfortable place to be, thinking about the head knowledge around racial equity. But in this training, we're going to ask folks to dip into that heart space as well. It's about our personal feelings, our personal identities, just ways to advance racial equity, our personal connection to it. It requires emotional investment. So I just want to put that out there, that we don't just want to have folks sharing facts and figures, but also like feeling it with our heart, what it means for us personally. And this is just another model that can perhaps be a helpful guide, the comfort, stretch, and panic zones. So that comfort zone in the middle, that is like where we're just talking about stuff that is familiar and easy. You've seen it, you know it, and it's not challenging or uncomfortable to talk about at all. We would love folks to move into that stretch zone or that learning zone. It's a little bit less comfortable. There's more of a challenge to being in that space. That's where we're learning new things. You might notice some changes in your body, like your heart might start beating, you might start feeling something, and that's okay. That's okay, that's what we want, that's where we learn. And so that's where we're challenging ourselves. We don't want folks necessarily arriving into that panic zone, which is like beyond the stretch zone, and we're no longer able to be present in the training. So that's where folks will just stop listening, and it looks different for various people, but if that is the case, if you feel that coming on, take a walk, take a step away, recenter, re-engage, and come back and join us when you're able to. So what's comfortable for one might be stretch for another. What's stretch for someone could be panic for another, could vary on a different day for the same person. So it's really just about you figuring out what feels right for you. So yeah, that's what I want to say about that, I think. And we've got some group agreements that we want to just anchor ourselves with. The first being, be prepared to be called on and share if necessary. We don't want to call on folks, but if we do and you don't want to share, just say pass. There's no big deal, no problem. But I'm hoping that folks are going to be so engaged, dropping comments in the chat and coming off mute, that we won't even be calling on people. We've got one here called Take Space, Make Space. I'm sure somebody knows what that means. I would love to hear someone share what you think that means, or drop it in the chat, what you think Take Space, Make Space means. Very popular group agreement. Your hand, yes, Sharon.
Oh, yeah, sorry, I had to unmute. I just means making space for others, and whatever they may have to share, but also taking the space or taking the podium, if you will, yourself.
Absolutely. Thank you so much. And thank you for being the first brave soul to come off mute and share in the space. So paving the way. Appreciate that. You're getting spirit fingers from Mo, so that's great. Perfect. So yes, please take up some space, folks, but we're going to be aware of mic time and create space for others as well. We want to be open-minded to new ideas. We want one person speaking at a time, so that's that one mic, which makes the hand raising function a popular option so that folks aren't coming off mute and trying to share at the same time. But there will be space for everyone to share. We've got 4 walls, in this case, 4 virtual walls. That really means that what's said here stays here and what's learned here leaves here. So take the lessons with you, leave the details. When you're sharing your learnings with your colleagues and friends, you can say, I heard in this training, da-da-da-da-da, but you don't have to say that Sharon from XYZ agency said da-da-da-da-da. So that's what we mean by that, otherwise known as the Vegas rule. We're going to offer each other grace and patience while we're in this learning space together. We want to create a brave space where folks can share their questions, share their comments, and we don't call it a safe space because I have no idea what it takes to create a safe space for other folks, but we do want a brave space where folks are stepping into that learning zone. And last but not least, we're going to be mindful of people's lived and living experience and truths with this topic. We're all at a different place in our journeys, and we're going to be respectful of that, and we're going to take a step forward together today. Anything intro-wise, Mo or Victoria, tech-wise, that I missed? No, okay. Folks, if these agreements sound like something that you can rock with today, I would love to see a thumbs up, a virtual thumb, actual thumb, a thumbs up spelled out in the chat. I'm looking at all these thumbs. I'm loving it. Great. Thanks, folks. Also a great way for me to see that you are here. So, I appreciate that. Well, you're going to have a chance to meet some of your colleagues now. We're going to do a icebreaker, a welcome and icebreaker, which is on the next slide. And this is going to be an opportunity for you to share a story with the couple folks in your breakout group. And you get to choose one of these 3 prompts. Obviously, you can't share a story on all 3. Choose one of these 3 prompts. You're either going to share a quick story about a place you visited that changed how you see the world, or you're going to share a story about a person you met from a different culture that helped you appreciate differences. Or share a story about a moment you realized that how you are different was an asset to yourself and those around you. Okay, there's 3 different prompts. You get to pick one, choose your own adventure, and of course, introduce yourself to the folks in your breakout room. You can share your name, where you're coming from, and all that. And when Victoria or whoever's creating the breakout rooms is ready, I would say we're good to go. All right, you'll be back in about 8 minutes. Any reflection on those story prompts or the experience in general of thinking about these topics?
It's nice to see the difference in everyone.
Thanks, Karen. April, what do you want to add?
Good morning, everyone. Just before we share, just recognizing that it's being recorded, I just wanted to clarify how the recording is going to be used or shared.
Yes, thank you, April. And I know when you were in the breakout room, Paula dropped an answer in the chat, but yes, you wouldn't have gotten it. So these recordings do get posted on the CHTI website, like in the library. And well, Paula dropped in the chat again that they'll be on CHTI's YouTube channel, and then we will send the slides out to everyone who registered for this training in a follow-up email.
The small groups are obviously not recorded.
Right. Thanks for pointing that out. I hope that answers your question. Carrie, what do you want to add to the space?
So on the flip side of everybody being different, our group actually, we pretty much all found a common thread with like travel, and brought up the issue, well, not the issue, but like food and how people connect over food and trying different cultures' food, and like going to a potluck where there's different kinds of foods, and what a you know, like an olive branch that is.
Yeah, thanks, Carrie. That's great. All right. Well, with that said, I'm gonna hand it back over to you, Mo.
Thank you all. Thank you for going into those stories. A little bit about like why we ask folks to jump in with those stories. I really like that reflection. And then also thinking about, you know, where is our willingness to kind of dig into? How much do we think about this? Where is it that this lives in our lives? And some of you might have pulled from an experience that happened a year ago or 10 years ago. That's something that's really present for you. Others might have had to dig a little bit. And I just want you to notice whether you had to go digging for it, or was it more present? Did you have something right away? Did you have to think about it? Because that presence of the story is part of the dynamic that we're going to kind of investigate as we're going. How do these concepts live within you and in your lives, and how do then these things come up in the work that you're doing, and how to bring them forward when maybe you're not used to having them be upfront. It's part of the reason that why when we did our introductions, we asked for, we each also talked about our race and ethnicity as a part of the conversation. To talk about structural racism, we need to bring race and racism forward. So we're going to do a little bit of that today to help do that. So we want to go to the next slide. Thank you. So structural racism. Three really quick questions that we'll try to trouble throughout the day. How do we see it? Like, how can we actually parse it from what we're seeing in front of us? What's the question of will? Are we willing to see it? And then people will ask you, is it real? And part of our ability to answer that question is how we are informed about it. How is it that we're able to talk about it? But also, how is it that we're able to show that it impacts and affects the people who we are talking to in our communities, regardless of what the makeup of that community is, or to what extent structural racism impacts directly the person who you're speaking to. So we're going to trouble that throughout the course of our time together today. We'll also be focusing in on this first part of structural racism, kind of defining and understanding it. We'll define and talk a little bit about policy systems and environmental change, setting us up for day 2, where we're going to dive deep into a couple spaces and really think about, like, how does your work impact this, and then how is it that we can actually take on reducing structural racism in the spaces that we are working in from wherever you're doing your work. So that's kind of the arc of our journey. And so this first question about are we willing to see it, or how do we see it, is what we want to look at first. So I'm going to give a few examples of the impact of structural racism and how we see it. So next slide. This is one of the biggest examples that we use in Massachusetts, and actually throughout the country, to kind of demonstrate what the impact of structural racism is. Household wealth in the greater Boston area for white people is $247,500. For Caribbean born folks or people with Caribbean background, it's $12,000. People with Puerto Rican background is $3,000, and US Black, this is African Americans born in the US, English speaking, is $8. We didn't do the whole chart, but this is the basic dynamic, is that for household wealth in the greater Boston area, white families have at least $250,000 as net worth. This is the median, so half the folks have more. And for US Blacks, that median is at $8. This is the impact of compounding systems working together to impact the population and what household wealth they are able to build. Throughout the course of our session, we'll be asking those questions of why. Anytime we're having conversations about equity, we need to dive deep into the why question. We're not going to do it here in this moment because we are going to trouble this a little bit later on. But I want to give this as just like an example. So if ever you're like looking for a really easy example with data that you need to put in front of folks, here's the result. And some folks will say, well, how did this happen? Or what are the things? But that conversation about why is the conversation about structural racism. What are the things that impact this kind of disparity? And that this would not happen by itself normally without some other inputs. There is a new study that's being done currently to look at this to see how it's evolved. It started during the COVID era, so it's been a little troubled by that. So we're going to see hopefully soon what the new data on this particular metric is. So next slide. Flint, Michigan. This is the water from the tap in 2009, and then the water from the tap in 2019. Again, another example of how the ways in which the infrastructure of a state impacted the city. The cities and towns right around Flint did not have this problem. Flint was uniquely charged with this particular problem. There were a few other places in the state that were also troubled by it, but almost all of those were places where there are predominantly people of color or areas with large communities of color. And it, this is one of those spaces where it did actually impact everyone, because if you lived in Flint, you couldn't drink the water. This is also really important for us to tease out that structural racism has impacts for everyone. It doesn't just, even though it can be very directed at specific groups, it doesn't just impact those groups. It often has continuing impacts on everyone in that community. And the next slide. This is Hurricane Katrina. Hurricane Katrina had a disproportionate impact on the African-American population in New Orleans. And one of the things that we learned from that tragedy was that there were multiple reasons why this happened to a specific set of folks in the city, based on where they lived and what their opportunities were. And so I've got a little quiz for you on the next slide that some of you may have taken with me before, but I'll ask folks to take it now. Which policy most aggravated the disparity between the circumstances of Black and white New Orleans? Was it Plessy versus Ferguson, which is this idea of separate but equal? Was it post-World War II housing policies? Or was it levy placement and land constraints? I'm going to ask you to answer in the chat, A, B, or C. I'll give folks like a minute or so to contemplate, and then I'll just ask you to start streaming in the chat what your answer to that quiz is. Got some B's, some C's. Bunch of B's. All in that order. Thank you, Nancy. C's and B's. I'll give you another 20 seconds or so, anybody who hasn't had a chance to. All right. Lots of A's, okay. Any other folks? All the above. Thank you for answering that question. So while all of these policies had a deep impact on the circumstances of Black and white New Orleans, the policy that had the most aggravated effect, the one that made the disparity even wider, were the housing policies post-World War II. This is about where people could live, and since then, where they could or could not move. Many of the folks who owned houses in the spaces that were most impacted by the Hurricane Katrina had already been deeply impacted by policies that devalued their homes and made it almost impossible for them to sell their homes with any amount of revenue to be able to move somewhere else. And so these were the folks who were very much house poor, and they also were the folks who were most likely to not have easy transportation to leave, nor the resources income-wise or so forth to go somewhere else easily. So that's the housing policy that's the policy that most impacted what we saw. We bring this up because we're going to be talking about policy systems and environmental change. We need to understand that it's not the individual choices of people, but really the collective choices of policies and systems that are dragging us through the inequalities that we are seeing. We've named a few things in this conversation so far. We are guilty of public health speak, so I want to just make sure that we touch base on some quick definitions in the next couple slides so that we're all on the same page. So if we go to the next slide. Health disparities. I'm going to ask a brave and lovely soul from Fall River if they could read this for us. Brave and lovely soul from Fall River.
That must be me.
Thank you, Aaliyah. I'm sure there might be others in Fall River, but you are definitely one of them.
Differences in the incidence and prevalence of health conditions and health status between groups based on race, ethnicity, socioeconomic status, sexual orientation, gender, disability status, geographic location, combination of these.
All right, thank you so much. And again, because our training is focused on structural racism, we will be looking at race and racism as the central disparity that folks are facing. Ask you to go to the next slide. Thank you. Defining inequities. How about someone from outside Massachusetts? Someone from outside Massachusetts.
I can
Patty
go.
from Madison, Wisconsin.
All right, go ahead, Patty.
Health inequities, the difference in health outcome that are systemic, avoidable, and unjust.
So systematic, avoidable, and unjust. Systematic that they happen in all these different places, avoidable because they shouldn't happen, and unjust specifically that there is a question of justice of why groups would be having these differences in outcome versus other groups. So that question is really what moves it into an equity. The example I use all the time is like there are physiological reasons why groups may have differences in health outcomes. So prostate cancer bigger in male identifying people, breast cancer more so in female identifying folks, and there are some others that are really about other conditions within the lives that they live. So, for example, dangerous working conditions, men and specifically men of color have greater injury rates and fatality rates from work-based injuries or incidents than women do. Some of that is about where people are working, what jobs folks have traditionally had or historically held, and what jobs folks are doing, and then the dangers that folks are placed in those jobs. So we can think about what's happening there. What are the conditions that cause the thing that we're seeing? Important here is that we are always looking at the conditions and not necessarily the choices, because choices are influenced by the conditions that people are in. So we really want to make sure that we get to that space of thinking about what's happening to the person that has created this outcome, including the things that might have affected their behavior and choices. Next slide. Thank you. One more, health equity. Let's see, we've had somebody from Fall River, we had somebody from outside Massachusetts. How about anybody from Western Mass? Anybody from Western Mass? And if anyone needs a definition from Western Mass, it's like everything past Worcester.
I read.
Appreciate you, Dallas. Go ahead, Dallas.
Health equity is achieving the highest level of health for all people. Health equity entails focused social efforts to address avoidable inequities by equalizing the conditions for health for all groups, especially for those who have experienced socioeconomic disadvantage or historical injustice.
Thank you so much. And there's some new definitions there. Healthy People 2030 has come out with their new definition, which basically is this definition, but also saying that we need to look at what are the historical things that have happened that are putting folks in these positions, and that we need to address those barriers if we're trying to build equity. We can't just build towards equity, actually address the things that are challenges to it and barriers to it. We also at times are pushed about the difference between equity and equality. So hopefully you've seen some of these in the past, and if you haven't, these are good resources for that conversation and to help people understand why we can't just give the same thing to everybody. So next slide, and we'll go one click at a time. So how many folks have seen this slide before, this differentiation between equity and equality? Couple folks there. Good, good, good. Stephanie Campbell, awesome. Can you tell me what you see here?
Good morning, everybody. Yeah, so basically, equality is giving everyone the same thing. Each person has one box despite their height. And then equity is giving folks what they need to be at the height of best view. So you see the person with the red shirt has one box, the purple person with the purple shirt has 2 boxes, so that they have advantage, a more better vantage point to see the baseball game. And I believe you're going to show the next slide with no fence. Am I right?
No, nah, good point, good point. So one of the things that happens is that folks like iterate on this. And so there's a slide that has like the no fence one. I actually don't use that one because part of that is saying that we are only going to reach for equity if we can get rid of the challenge. And some of this is just not realistic for the work that we're doing, although that is the world that we want. I want to be able to see, you know, the Red Sox without paying for it. Absolutely. I'm that guy. I want to get rid of the green monster. I want to sit there on, you know, Lansdowne Street and watch the Red Sox, but they so far have not been willing. We've tried for some time, but they're not giving up on it just yet. We have actually another one that I want to share. If you want to go to the next one, let's click. How many folks have seen this one as the differentiation between equity and equality? You don't have to like physically raise your, you don't have to like put up your hand if you're worried about me calling on you. I just was going to call on Stephanie anyway, so she got that one. But anybody here want to say what they see here? Brave and lovely soul. Trying to entice with that description.
Well,
Go ahead.
I'll just say, I mean, I think it was just answered very well in the prior picture. And it's, you know, sort of similarly doing the same in terms of giving everybody the exact same thing, although it might not be what they need, or giving them a stool or base to stand on that brings them all at the same level.
Someone in the chat added it's giving people what they need to reach the same goal and not one size fits all. Thank you so much, Sharon. This idea that we need to actually give folks the thing that's actually going to get them to the same outcome. Thank you so much. Thank you, Catherine pointed out the health approach and the healthy foods piece there. Yep, absolutely. Let's next slide. All right, this one's actually my favorite to think about the differences in equality and equity. So at the top of this duet is everyone getting the same thing, working from left to right. It doesn't work at all for the first person. It looks really cumbersome for the second person. It works perfectly for the third person, and looks pretty dangerous for the fourth person going left to right. Equity is giving folks what they need to be able to get to the same goal. And so the bottom framing is that everyone is getting the thing that would actually work for them to get to that same goal. Stephanie, is your hand still up from before, or is this a new hand?
It's a whole hand.
It's a whole new hand? Go ahead.
No. I said it's an old hand. Let me make sure my audio is clear. I forgot to lower it.
All right. It's a previous hand.
Yes,
Astrid, go ahead.
A well-lived hand.
There you go.
So what I noticed is in the middle, and I've seen all these images before, but the first time I've now noticed is that if you see the first box, they're taking the same amount of resources and redistributing them.
Yep.
In the center image, we're using twice as many resources. And that's oftentimes the pushback that we hear from decision makers or people who are poo-pooers, whatever, to say, it's going to cost us more to make sure that everybody gets what they need. So I just want to point, so that was, I've never seen that in that central image, is they're using 6 portions in the equity versus just redistributing the 3 as they did in the first image. And I hadn't seen that before. Thank you.
Absolutely. In the chat, Nicole says this last one to me is also great representation, also meeting people where they're at. Absolutely. Ashley said that we also need the image of reality, that some people have fancier bikes and front row seats to the Red Sox. Absolutely. And kind of making sure that we're also talking about these representations of equity and different resources. Thank you, the other Ashley. The next click kind of illustrates where Astrid was going. So the first slide is about redistributing the existing resources. The second slide is about adding resources. And the third slide is about adapting resources. And in our search for equity, we're going to do some mix of these things. One of the challenges is that pushback is in the first one, where you're redistributing resources, folks feel like you're taking away from someone something that they have or feel like they've earned to be able to give it to someone else. In the second one, you're adding resources, and it's also about, can we afford to do that? Who is getting this resource? Why are they getting it? Am I not getting it? And in the third resource, in the third one, why can't we just give everybody the same thing? And how come that doesn't work? We have been sold on these ideas of equality, but not equity. And so we have to retool our brains that it isn't about giving people the same thing if they are different distances. One of the ways I talk about it is if you start a race and the people who you're running against are 100 meters in front of you and the race is 400 meters, it makes it really difficult for you to win that race. And you probably give up before you get there. So really we want to create a baseline that is as equitable as possible so that folks are starting from the same place, or at least have an opportunity to get to the same place that's realistic, that's resourced, and that's encouraging. So thank you all for taking that stroll with me down the equity versus equality path. Again, these are good resources for us to think about and to use. I know sometimes you get into these conversations. We're going to take our first 5-minute break of our time together. I'm going to ask you to spend 5 minutes away from your screen if you can. I know some of you may need to, use this time to check email, check on someone, maybe those of you who might need to get a glass of water or something, please do that. If you are someone who benefits from moving around, please do that to the extent that you are able and willing, and we'll be back in 5 minutes, but I will ask you to turn off your cameras and your sound for those 5 minutes. And maybe, Victoria, if we have some music, we could even play that if we wanted to. All right, see you all in 5. Thank you. We did the break thing, relatively well, so which means we can do them going forward. I'm always like, hey, let's test it out and see how it goes. So welcome back. No one got captured. I would love to hear if someone did something really interesting in their break. Anybody do something really interesting in your break time? Anybody feed a pet or a child? Anybody step outside?
My coffee cup.
I'm sorry, what'd you do, Ashley?
I washed my coffee cup in the sink.
Wonderful. All right. How long had it been?
About 5 minutes, actually. I just finished it, so I got right on it.
Okay, good. Someone did some meditation. Sharon, what did you do?
I made a new cup of coffee.
Made a new cup of coffee. All right, good stuff. Cool. Anybody go outside? Anybody step outside or step away?
I said hi to Victoria.
Good, all right. Thank you. Good stuff. All right, let's jump back in. We go to our next slide. As I get older, all of my teachers are younger and younger. One of them is Nashira Burrell, who has done some amazing work in helping us all to understand equity. She's been one of the trainers that has supported the development of our understanding and really the idea of actualizing and operationalizing equity in our work at HRIA. And we quote her here from one of the spaces that she has been working in, although now she's founder and runner and the operator for the Neighborhood Birth Center. She's done a lot of work in the DEI space. Can I ask a brave and lovely soul to read this one? Maybe somebody from the North Shore. Anybody from the North Shore? And I'll say North Shore is anyone north of Boston before New Hampshire.
I'm not from the North Shore, but I'm happy to read.
I'll take it, Stephanie. Why not?
We must build a deeper understanding of racism as a system of advantage. Otherwise, our health equity efforts are bound simply to remain
diversity and inclusion projects. Diversity is about mixing it up, and inclusion assumes that the existing arrangement is essentially working fine and dictates a practice of accommodation where diverse people are given concessions to help them cope within the existing paradigm without changing it up in a shareable way.
Thank you so much. One of the reasons why we share this slide is that often folks are like, yeah, we do diversity and we're a pretty inclusive space. Why do we need to get to this equity landscape? And what Nashira is pointing out here is that if we just are trying to include people by having them present and making accommodations for them, we're actually not changing the underlying systems that are creating the inequities that we see. And so we need to actually be working towards equity to really sustain and empower and create the inclusiveness that we're looking for, and to sustain the diversity that we're also trying to create. And equity also helps us to ensure that we're being effective in the outcomes of our work, not just in the attempts that we're making. When we hold ourselves accountable to whether or not we are actually making a difference for the folks who are most impacted, and how it is that the inequities that they are facing are being addressed or reduced. So we're going to use this framing to ask a really important question. If we go to the next slide. Are we willing to see the problem? So we're going to do a little exercise here. We'll be in the same small groups that you were in before. After this small group, we're going to reshuffle, so you'll meet and talk to some new people. But since the other one was really about introductions and the story, we want to do one that's a little bit more content focused here. So for this one, we're going to take Sharon's advice and do 10 minutes. We're going to ask folks to have a conversation with each other, and I'm going to give you what we're talking about. So if we go to the next slide. All right, this is live births per 1,000 in Massachusetts. Live births per 1,000 in Massachusetts. One of the things that we see is that we are following the trend or the historic evidence of these disparities in live births across the country. In Massachusetts, non-Hispanic Black births are at twice the rate of non-Hispanic white births in terms of infant mortality. So I'm going to ask you just to look at this chart. In your small group, I want you to answer the question, why? Why is this disparity in place? This difference in infant mortality between non-Black Hispanic and non-Hispanic white folks in Massachusetts. And I'll add to folks that this is 2017, but this has been the case for the last 40 to 60 years. And this rate is slightly better than where we were in Massachusetts 40, 50 years ago. But we're going to put you in small groups. I'm going to give you 10 minutes, and I want you to talk about why. And when you do the why, I would ask you to remember our agreements. That grace and patience means that people are here with the best intentions. We're here to explore and learn. And so I'd love for folks to allow themselves to, maybe say it not as perfectly as you would like to say it. Maybe be, a little bit off in what you're getting across. Maybe not have it fully cooked if you don't have it fully cooked. But I'd rather you say it out loud so that we can actually talk about it. So I'm going to ask folks to just share in your small group what might be some of the contributing factors, even if you're not sure, like, could it be this and could it be that? And then we'll explore it when we come back, because part of being willing to see the problem is to start to identify the contours of it and some of the reasons that could contribute to it. And then check and see if those reasons are actually real or not. So we're going to give you 10 minutes. Why is this disparity in place? And we'll see what folks come back with. Well, welcome back. I want to remind folks that I asked you to share some of those uncooked ideas, things that maybe you hadn't like all the way go through, because we want to like brainstorm and get all the things out. So I'm going to ask if folks could just put it into the chat, any of the things that you all talked about, and then I'll take a few examples for why is it that we see this disparity? Why is it that we see this disparity in the infant mortality rate between African Americans and white folks in Massachusetts? So just put in the chat. I see lack of cultural sensitivity training, communication barrier. What else? Lack of availability of POC doctors in certain areas. Let's keep going. What else? What else did y'all talk about? Lack of access to facilities and transportation, historical and ongoing trauma, all kinds of types of isms, prejudice, bias, rapport, medical practitioners not listening to patient concerns, environmental conditions, access to care, stress, dismissiveness, poverty and access, transportation time, multi-generational caregiving, lack of humanity, not competent, structural racism, insurance discrimination, resources for patients, income levels, high rates of unemployment and limited access to quality health care, personhood, limited coverage for folks depending upon their medical insurance, environmental factors, lack of directness in the conversations, physical impacts of stress, racism on the body, lack of trust. Conversation went to broader, this question of willingness to see the problem, lack of BIPOC doctors, number of hours worked, shifts worked, initial cost of going to school. So some of the things that put folks in the spaces that they are in to begin with. So some direct conditions and some indirect conditions. Really important that we like pull all of these out, because when we correct for things like education level, when we correct for income level, for access to healthcare, for whether folks are living in a suburb or an urban environment, when we correct for all those things, these disparities persist. So that an African-American woman who, or birthing person who has a good job, has good insurance, goes to a good doctor, goes to a good hospital, has a degree, had a great education, lives in a suburb, has all of the things that we kind of count as positively contributing, still experiences these levels of disparity. And so it forces us to ask what else is going on there. And I appreciate that folks named some of those things like racism, the impact of racism on the body, people not being listened to, the treatment that they have. And one of the really, really tough things about this issue is that research does show that when you have what they call concurrence, when you have a Black doctor working with a Black birthing person, the child has better outcomes by 30%. And that is an indictment on America, that the race of the caregiver would be such a determinant on the welfare of the child. We've really got to think about what is it that we're doing and not doing that's putting these children at risk, and that we're not going to get enough providers of color into the pipeline anytime soon to be able to have that concurrence be a factor contributing to good outcomes. So we actually have to do something that changes the environment that people are in, address the racial stress and trauma that folks are feeling and the spaces that they're going to. And that's one of the reasons why we ask this why question, is to dig into all these spaces. So when you're seeing a inequity in place. And this one, we can really see how it's unjust. It happens everywhere, regardless of where people are, and it should be avoidable. This shouldn't be something that should just happen. It really makes it a really glaring inequity. And it is one of the glaring inequities that has persisted in the United States over the course of the last 60 years. We are in Massachusetts, which actually does better than other parts of the country. Nationally, this, here it's about 2-to-1 between African American and white American folks. In the country, it's about 3-to-1. In many places, about 3-to-1. So I think it's 2.3 is the exact number for the country taken as a whole. And really challenging, because we should actually be able to do better than this.
Right.
And that there should be, things that we can do to increase this. Thank you, Nancy, put in the chat. In Massachusetts, the liability insurance and student loan amounts specifically affecting OBGYNs also is a barrier to skilled new and diverse practitioners. Exactly. And many states are trying to address that. And Tahara put in, a lot of Black providers are a part of grassroots because the strength in their voice in addressing these structural racism is hindering access to bigger space unless they're looking to meet a quota. Exactly. So they're not even getting into the pipeline to be in those spaces. I'm going to ask you to do a little quiz with me, but I wanted to just ask Lauren if there's anything you wanted to share before we do that.
Thanks, Mo. This topic just makes me think about the headlines from Louisiana from a couple of years ago, where the mortality rate is 4-to-1. And it just brings in, like, when folks have the idea of like race blind policies and like don't make things about race and all that, when the governor of Louisiana said that the mortality rate would not look so bad if they just like de-aggregated the statistics of Black women, it wouldn't be such an outlier. And it's a heinous thing to say. It's also, I want to acknowledge the impact for folks on this call, especially Black folks on this call, hearing a white person like repeat his words, because they're not correct or welcome. But
no,
what we do with data and how we manage data and collect data really matters. And that's, we have to, otherwise that could just be hiding in some data because we're not looking at race. But we absolutely have to, because it kind of brings to the surface what's actually happening around the country, in Louisiana, and right here at home in Massachusetts.
So I'm going to ask you to take a little quiz with me, because I like doing quizzes and we are doing some learning. If we go to the next slide, and you can answer in the chat. So in this same time period, which country had a lower infant mortality rate per 1,000 live births than African Americans in Massachusetts? Is it A, Cuba, B, Taiwan, or C, Portugal? And I'll just ask folks to put it in the chat, A, B, or C. Which country had a lower infant mortality rate than African Americans in Massachusetts in 2016-17? Lots of A's going so far. Saw a B in there.
lower infant mortality rate.
Yep. Which country had a lower infant mortality rate than Massachusetts? Lots of A.
All.
I see an all for Jessica. Give folks another 10 seconds if you want to answer. Some A's, some B's. Aaliyah, our Portugal is getting no love in this one. I don't know what's going on there. So the answer to this question is actually what Jessica said. All of these countries had a better infant mortality rate, meaning lower infant mortality rate than African Americans in Massachusetts. We are alone almost in the quote unquote higher economies in the world of having this kind of disparity happen to a population. And spaces that have worked to address this have, over the course of the last 50 years, really lowered their rate, including Cuba. Cuba is the place that trains the most doctors and does it for the least cost. And so they have had healthcare, kind of what we would call universal healthcare for a very long time. And they train medical professionals not only for Cuba, but for all over the world. My dad had surgery in Cabo Verde. I'm Cape Verdean, and his doctors were Chinese and Cuban because they have traditionally trained folks, and they were able to communicate because the Chinese doctor was also trained in Cuba, the Cape Verdean doctor was trained in Cuba, and the Cuban doctor was trained in Cuba. So they spoke English, Spanish, Mandarin, between 2 or 3 of them, but Spanish was the common language, as well as the Portuguese that they use locally. They've been exporting medical professionals for pretty much since the revolution there. Taiwan also had a really big program to secure their medical professionals, and Portugal, like most of Europe, has had universal healthcare for a very long time. Thank you for taking that quiz, and partly I wanted to bring it forward because we have to challenge ourselves about what we're seeing. As Lauren said, we've got to disaggregate the data, which is probably one of the most important parts, to get down to what is the experience of the communities we are seeing, and is it something that we are willing to look at, and then asking those big questions of why. Why is this happening? How is it happening to folks? Because that allows us to then think about what can we do about it. So I'm going to pass it over to Lauren to take us in our next steps.
All right, thanks, Mo. So another big question on the screen, and I'm hoping we can open up a brave space where folks might share. What messages did you receive about race while growing up? I would love this to be, a larger group discussion. Folks can drop something in the chat or come off mute and share any messages you received about race while growing up.
I'll start. I suppose I may have even had a little bit of thought on this within the small breakout group, because sometimes I used to say, it was like, well, why do I not really have that many specifics in terms of conversation and discussion? And I think part of that is because it didn't happen. It was and some of the reactions to people learning of it at long last. I mean, I always felt like I tended to know or feel more about it. But folks had their eyes opened, recently with regard to a lot of what has happened, particularly since George Floyd and all. But one of, I was raised Roman Catholic, so therefore not a WASP per se, if you break down that acronym. But at the same time, it was implied, but not maybe discussed with us as children, but they had a high school. When I grew up, our family was one of the first to enter a new high school that was built in the town where I grew up, because all of us would have ended up going to the city high school, which had a predominantly Black or person of color, because the city of Poughkeepsie was where the lower income housing was, and all those opportunities that we're showing on charts today. So it was under the table or under the tablecloth. It really wasn't so much there. I actually found out more and more about confirmation of my suspicions with regard to the high school, because that's what I told people. They're just building this damn high school so they don't have to send their white kids to the Black school per se. There was a woman who was a professor, not sure if she was a doctor, but a professor at the State University in New York in New Paltz, and she did a case study about the entire thing. I reported it myself on a course I took at Cape Cod Community College. It was like she just went into all of it. It was like, oh my God, I was right, and I got all the detail about it. So I don't mean to take too much space.
Thank you, Karen. Thank you. It sounds like if things weren't said explicitly, you were noticing implicitly some something was going on regarding the high schools. I see lots of stuff in the chats. Speak properly and dress well to make yourself less of a target. Follow instructions. Don't stand out too much. Don't threaten white people's safety. And you should be okay. That's an incredible message to grow up learning. Those Metco kids, quote unquote, are trying harder than you are. You take everything for granted. We're all the same. Looking at race is racist. Being told that looking at race is racist. Yeah, it's not uncommon. Nonverbal experiences lead to ideas like Black people are criminals, drug addicts, uneducated, didn't deserve equal access. We're reminded that we were slaved with the annual move roots, and most of us were the only Black kids in class. Folks being biracial, not knowing a Cape Verdean father, went to Catholic grammar school, all the direct messages about equality, but inferred messages from peers and media. Yeah, there's like what's said explicitly, and then what's like the messages that we're getting from every other direction, highlighting the differences between race and sex. Implicitly, as a white person, separate and be better than. Assimilate to whiteness to make it. Prejudice against darker skin. And in Spanish, a saying to mejorar la raza, to better the race, which meant be more white passing. Thanks, Jessica. Tahara, we have to lead with race to create intentional change. Yes, yes, yes. Appreciate that. I mean, I know for myself, when I was a kid, like 3rd grade, 4th grade, I had 2 best friends that were Filipina. And at that time, 3rd grade, I didn't know that they weren't white. I thought it was, the message I got was there's Black folks and there's white folks. And if you're not Black, you're white. And I was like 3rd or 4th grade when I don't remember how I learned. But the message came and it was like, whoa, it was revolutionary. It was mind-blowing. That was the first time I remember learning that there's like more than 2 categories. So, oh, yes, and Magalis adding the message about immigrants stealing resources. Lots of great sharing in the chat, folks. I appreciate it. Yes, and I appreciate, I know the video is being recorded, so I'm not necessarily naming names, but bringing in some of the ideas folks are sharing. Folks sharing about growing up with a white mom and an immigrant father from Ecuador, not being taught the native language to encourage being American citizens. Yeah. Don't remember verbal messages, eye rolls in response to racist comments. Yeah, yes. Thank you, everyone, for sharing. Yes, we receive lots of messages about race, or don't receive messages. I will say, as a white person, I didn't receive a lot of direct messages about whiteness. Race was out there, and whiteness was sort of just given a pass, I guess. Someone sharing growing up in a predominantly white area, racial diversity wasn't present. Family was taught about diversity. Didn't understand the discrepancy between actual US history and what we learned in school until things like the Tuskegee experiment and Cooper Island were brought up. Yeah, a lot of great sharing in the chat. Astrid's got the hand up.
I'm going to share a little bit of a perspective from someone who didn't grow up in the US. And I had a Dutch father and American mother. I grew up in West Germany. My father, very early on, made the explicit connection for me, because I was the oldest, so he started with me. The connection between, so he grew up in Nazi-occupied Amsterdam. They arrived when he was 10, they left when he was 15. So moving to the US, for him, he brought me up and us up, all of us kids, to make explicit connections between what happened in Europe with the spread of Nazism and the Jim Crow laws in the US. So I learned about American racism as an observer through the eyes of someone who wanted to make sure that his kids knew exactly what it was about. I learned about racism and Jim Crow laws rather than race, so I got messages about racism. And my father brought me up to say, if you're not saying something, you're part of the problem. At least acknowledge that not all voices are in the room. We might not know what they would say, but just acknowledging we're not fully represented here as people. And so it's a little bit of a different perspective, because I viewed racism that was happening in America from that outer perspective, while living in West Germany, where there was certainly xenophobia, because at that time, I grew up there in the 60s and 70s, there was a large amount of xenophobia perpetrated against the Turkish immigrants who were there, coming in to work, to send money home to Turkey, etc. So there was certainly no lack of xenophobia. But because West Germany at that point was very mono-racial, completely Caucasian white folks, I learned about racism externally, which is a different perspective. So I just wanted to offer that. I'm sure there are other people in this room who also grew up somewhere else and learned about American racism as an observer.
Thank you, Astrid. Mo, anything you want to add before we continue?
Yeah, I just, Astrid, I'm not sure you can come on here and lie that you were alive in the 60s.
Hey.
Like, we're not just going to let that go. Like, come on now.
I was born 61.
No one believes you. But thank you for that perspective, that one of the things that we have exported has been this particular brand of structural racism, and that in many places the things that were built here have gone on to be implemented in other spaces. And Astrid, thank you for also bringing up your father's experience, because we forget that, yes, the Holocaust and that era was deeply impactful in the lives of Jews in Europe, but also in those same spaces were another 6 million people who were Poles, people of Polish descent, who were African Americans, who were LGBTQ plus folks, who were Roma folks, who were a lot of other folks who got othered and also met the same fate. And that
People with
lesson
disabilities.
from people with disabilities, exactly. And that lesson from our German brothers and sisters is a really important one, that we need to address this stuff right from the beginning.
When you were mentioning disabilities, I was also thinking about, in particular, the deaf community. And the influence of eugenics and Alexander Bell not being the hero everyone thinks. And there's still a stigma. I took the ASL class, and it's just not my mother's also completely almost lost her hearing. It's there's such a stigma too, and you had just said, Mo, othering. There's definitely an othering going on there too.
Yeah, thanks, Sharon.
And how truly dangerous that is, which is the example. Appreciate that. Back to you, Lauren.
Especially when it intersects with race.
Excuse me. Hello?
Yes, hi.
Let me ask you a question. How you doing? I'm hearing that we talk about racism as we're going across the world now. And I'm hearing what really puzzles my small mind is that we talk about racism and the experience that Europeans have experienced racism among Europeans. But no one is talking about the European experience in the island, in the Caribbean. That a couple years ago, the Queen of England passed away. Now, she was perhaps one of the most beautiful queens to the African continent that any other colonist had ever experienced. But no one talked about Queen Elizabeth II. And that's sad that the hundreds and thousands and millions of people in the continent of Africa suffer under the Queen Elizabeth throne because of racial policy stripping the continent of its resources that made the European comfortable, made America comfortable, consumers. I mean, if we can talk about racism, let's talk about poverty, which is the third or fourth largest cause of death in America. And the question you asked about the birth rate between Cuba, came from a third country, and we see how the Cubans have fought and educate these people from the 50s to now. I remember when I was in East Africa back in the 70s. I'm American citizen, born and raised in the South. And I met many Cubans all throughout Africa working, doctors. They export 5,000 doctors a year to Africa, period.
Yep.
And so if we're going to expand globally, let's talk globally.
Abdullah, we're having trouble
30,
hearing
40.
you. Maybe turn off your video. We might get a
Yes.
better connectivity. And yes, the example I gave was exactly that of Cuba exporting their medical professionals all over the world, including to Cape Verde and Africa, where my father was sick and had those doctors. Absolutely. And thank you for expounding on the influence of colonialism as well, which is at the root of the racism that we have had here in the US as well. There is a cyclical relationship between these. So as the Germans were learning from the Americans, it was also that the Americans had learned from colonialism that brought it there, from the Portuguese and the Spanish and the French, the Dutch, etc. Absolutely. Thank you for rounding that out for us. Lauren, I'll pass it back to you so we can move forward.
All right, let's see that next slide. We're going to do a little bit of level setting, just, race. What is race? This is not based in science or genetics. It's how people in society categorize humans. It's based on observable physical features, but it's not based in anything scientific. So who was assigned to each race has shifted over time and was determined by those in power. So on the next slide, we're defining whiteness. What is whiteness? Whiteness was invented. It only exists in relation to other racial categories, and it was created by white power holders to codify the superiority of white people over others. So the definition has changed over time. It has been determined by white folks. I'm sure folks know, but I would just point out that who is considered white has been determined, and folks, there was a time in this country where only American citizens could own land and only white people could be American citizens. And so the government was sued over and over and over again to include groups of people to be considered white. As recently as 1944, the government has been sued by different groups of people to be considered white so that they could become citizens, so they could buy property. So this is like, what is it? Supreme Court justices, a bunch of white men deciding who can be considered white and who is not considered white. And it is really just to hold the power. So also whiteness considers the presence of white identity across ethnicities that by and large are considered not to be white. So folks, based on the convenience, the preferences of folks in power, who's considered white and not white, based on the situation and the circumstance, and based on skin color. Mo, you came off mute.
Yeah, I just want to mention that, for a lot of folks, when we talk about race and racism, we fail to define and provide a space to talk about whiteness. And that's why we want to make sure that we did it here, because this is seen almost as if the normal is white, so we only have to talk about the other, and we need to change that dynamic and bring those definitions into the space and have a white identity be an identity in the same range that all the other identities are along race. And I really appreciate how this is defined about the changing ideas of who gets to be and is white over time in space and as a function of our legal system, not some definition by the people who are trying to join or disjoin from that community. So
Thanks, Mo. So on the next slide, we're going to talk about racism. We're going to bring in Dr. Kamara Phyllis Jones. Racism being a system of power and oppression that structures opportunities and assigns values based on race. This unfairly benefits white folks, advantages white folks, while unfairly disadvantaging people of color. And so I like how it's broken down below that racism is a system of oppression based on race. It's a system of advantage based on race. And racism is when you have racial prejudice plus institutional power together. There's nothing wrong with power necessarily. It's the capacity to act, to have influence. But when it pertains to racism in America, this is where the systems and institutions are built and structured to benefit white people. So that leads to the inequalities that we see today. So we're gonna just review a model for understanding racism. There's different lenses that can be used. And so this is the one that we're going to use here today, just to talk about different levels and examine racism. So there's these 4 levels. There's macro levels and the micro levels. And we'll start just sort of teasing apart each one a little bit. So the first would be the internalized. That's on the next slide. Internalized racism would be lying within an individual. These are private beliefs about race that reside inside our minds. And I would say that for white folks, this would be internalized supremacy, internalized superiority, internalized ideas of entitlement, of belonging, of thinking my voice needs to be heard in every room I walk into. That is internalized racism in the form of white supremacy. These slides will be shared with everyone who registered. Yes, Patty? And so the opposite of that would be internalized racism for folks of color. The, feeling of inferiority, of not belonging. On the next slide, we've got the interpersonal. So this is when we talk about racism and someone says, I'm not racist, this is what they're talking about. They're talking about bringing private beliefs about race into public interactions or into interactions with other people. So person to person. This is the racial slurs, this is the jokes, this is all the way up to hate crimes and racial violence, but it also includes what's called microaggressions, which is a euphemism because it's not micro. It's like death by a million paper cuts. But this is what we think about, or what I think about in general, or have thought about in the past about when people say racism. They're talking about between individuals. On the next slide, we've got a descriptor of institutional racism. So this is within our institutions. So this picture seems to be giving us school. It's the idea of school, the graduation cap in the books. So this would be, the school suspensions and detentions and who gets tracked into the AP classes, who gets tracked into the college track, who's high achievers. It also applies to every other institution around hiring practices, profiling, every manner of the way that racial bias and prejudice are sort of codified in institutions. And in the final, I believe there's one more. There's not. So the systemic, which is not seen here. Racial, I guess this is it. Systemic is across institutions and society. So it's like the collaboration between the institutions, the cumulative and compounded effects of an array of factors that privilege white people and disadvantage people of color. So some examples would be putting 2 together, housing and banking, and how they would collude to redline communities and make it impossible for folks of color to purchase property in neighborhoods that will appreciate in value, for example. So that's a quick overview of these levels of institutional racism, of racism. And on the next slide, we've got, and is this a place for a breakout, Mo, or what are we thinking? Yes, okay. So let's look, yes, here we are. What does it look like? So we would love for folks to go off into breakout rooms and try to think about these levels, think about examples that you might bring back to mention, to bring into the space. This is like going back to that question of, do we see it? Can we see it?
Welcome back. Love to hear from a couple of folks, maybe some folks we have not heard from before, about what they talked about, or any examples of what racism looks at these levels for folks. Any examples? And Tahara, thank you for putting the links in there. I'm going to encourage folks to visit those after our session or during our break that we're going to have in a few minutes. Any examples of what the differing levels of racism look like in your spaces? Raven, lovely soul. I could see that y'all were talking because I can see the mics going. So I will give folks a chance to jump in themselves. Someone who hasn't spoken up yet? All right, Tina. Tina, you still with us?
I'm here. Hi, Mo.
Awesome. Hey, what did y'all talk about in your group?
There were a couple conversations about food equity and how that impacts kind of the greater system of people being able to get the food that they want. Specifically, we spoke about the Hispanic population, about how food access is challenging and also like culturally relevant food and the cost that inhibits that. And then we were kind of talking a little bit about marijuana too, and how that has become an industry that has taken over some of these towns that used to be like mills and industry, and how that money is coming in, and specifically like how that money that's produced is being put back into the community, or where it's being put back into the community.
So much. And if you had to say like at what which level those things were happening, which of these levels would you note?
I mean, I think it's more institutional and systemic.
Yeah, absolutely. Thank you so much for that. If you think about like where a supermarket is or isn't, is definitely an institutional policy, but there's also some systemic stuff that's going on here about where they are in general. So where there are food deserts and where there aren't food deserts. Absolutely. Thank you for that. Let's hear another group. Maybe somebody else. Go ahead.
Yes, I would like to say it's something that we highlight in the group, that we were talking about how the system is working constantly against us, because the role is that they keep us divided, you know what I mean? In our own community, we internalize oppression and we keep, they keep us divided. So Abdullah was bringing the sample about what's happening with the housing system during the year 60, that they keep segregating all people of color, and that's a real example how the institutions are working against us to keep us divided. And that's something that I'm just watching every day in my community, you know what I mean? So that was very powerful. Thank you.
Thank you for sharing that, and shukran, Abdullah, for sharing that as well. Carrie, were you trying to jump in?
No, I was just saying that in our group, I just wanted to share, like in our group, we were talking about, what it looks like, what racism on all these different levels looks like now, how that impacts our community now and us as individuals now, and also, how we can improve things moving forward. We're all seem to be in a role professionally where that's the goal. To promote equity and some in specific terms of health literacy and health wise. And how do we do that from, in terms of recovery coaching, community health workers, and as institutions who provide the backbone of our healthcare, is how do we do that, and how do we allow that space and to take place, and that information to happen, and that support to be given, and share ideas, and not kind of repeat history. I mean, we've seen separation and segregation, and we refer to ourselves as a melting pot, but a lot of times the melting pot really wasn't actually melting things together. It was people feeling pressure to assimilate to the community that they're in, whether you're immigrants or whatever, it's to be more like to fit in and to do what you have to do to fit in, instead of really truly learning from each other and having a culture that is diverse because of that, because we've all taken the best, what we feel are the best from each other's experiences, and adapted a new culture where everyone can fit and everyone has space and everyone's treated equally. We've historically have some atrocities that we've committed as a country, and how can we learn from that and take those lessons and move forward? Because if we don't do that, then it's bound to happen again. We don't want to repeat what's already been happening.
Yeah. And also continue the things that have happened, that continue to have the impacts. Absolutely.
Right.
Thank you so much for that. I'm going to ask us to again take a short break, give you 5 minutes, and ask you to turn off your screens, maybe look away from your screens. If you are inclined and are willing and able to move around as to the extent that you can, and then be back in 5 minutes so that we can get moving quickly. So I'll see you in 5. All right. Let's move on to the next slide. We've been talking kind of broadly about these spaces. We're going to get really narrow in our last hour around structural racism and kind of the implications and manifestations of it. Could I ask somebody with a clear and loud but wonderful voice to read this definition of structural racism for us? So
I'll do it.
Thank you so much, Sharon. Go ahead.
Structural racism refers to the totality of ways in which societies foster racial discrimination through mutually reinforcing systems of housing, education, employment, earnings, benefits, credit, media, healthcare, and criminal justice. These patterns and practices in turn reinforce discriminatory beliefs, values, and distribution of resources.
Thank you so much for that. Really narrowing in that structural racism is about how these things overlap and work with one another. Another term we use is they compound their effects. One way that folks have talked about the impact of racism is like a bird in a cage. And so even though they see only one bar at a time, the bars are aligned so that they will believe that they are there. And so even if you open the cage, after a while, the bird won't even leave it because they can't see that it's blocking their way. And so it's not that you have been discriminated against. Anyone can be discriminated against. It's when the totality of systems are having the same influence and impact that we're really talking about. Racism and structural racism are the structures that actually make that happen. So we're going to dive a little bit deeper if we go to the next slide. How does an ant swallow an elephant? Thumb, 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 thumb. Anybody? Hopefully you've heard this one before. How does an ant swallow an elephant? Somebody chime in.
One bite at a time.
One bite at a time. Thank you. One bite at a time. And it's one of those that we have to remind ourselves that trying to change something at the societal level is huge, and we should be involved and engaged in that enterprise, and that we can make smaller changes at the local level in the spaces where we are that also contributed to that positive, broader change. And so we want to believe and see ourselves as being powerful in making that happen. And we need examples. So throughout the rest of our session today, and when we reconvene next week, we'll be showing you some examples of policy systems and environmental change that's getting at addressing structural racism and building towards racial equity. I want to share one resource today. Our friends from the National League of Cities have this compendium of strategies and examples and areas in which different cities are addressing structural racism. If we go to the next slide. These are just some different strategies and strategy areas that they're working on it. I will share the link so you'll be able to look at these for yourself. But I wanted to pull out 2 of them because these are things that are important for the work that we do wherever it is that we do it. Are we budgeting for racial equity? Are we using our ability to spend money to address the inequities that have persisted and to provide a redistribution of resources, much like we saw with the boxes, so that we can get to equitable outcomes, and that we need to do the data collection and disaggregate the data so that we can actually see the impacts and effects of the structural racism that our communities have. There was a question in the chat about, what if we stopped using these designations and taking the data down that way? Would that address the racism? And and this question gets asked a lot, and just say that up front, it's not the categories that are divisive, it's the ethos that actually divides people. It's the way that folks act with one another that creates the division. The data allows us to see the impact of those divisions. Our friends in France are struggling with this right now. How do you combat racism when you can't capture it, you can't demonstrate it because you're not allowed to capture that data? And ironically, many of the scholars in France who are trying to do this work are coming to the US to learn about the presence, the work and the struggles of Africans in France and people of color in France, because they can't get it at home in their own country. Thank you for jumping in with us. Part of this is also to start to bring some examples. So I will pull some of these examples throughout the conversation. Some of you have named some of these already. Brother Abdallah, go ahead.
Yes. I'm gonna, you said something about how the French is coming to America to study our issues going on.
No, they're studying their issues because they don't have access to the history of the presence of people of color in France in their books in France, because that naming of folks in biracial categories is something that the government doesn't allow them to do. So when they come to the US, they can look at histories and understand the complexities of race and class in their own society, but they're not able to really do it in French in France.
I visited France several times. I have many friends from North Africa who live in France, in France, and that's an issue. I mean, that's that's like calling it. It's like my grandmother said, call it the kid of black, you know.
Yep, absolutely.
You know, but I was gonna say something about that really quickly.
Go ahead, brother.
You know, everybody from the 20s came to America to study how America did with racism. I can remember reading a book, two books, matter of fact, back about 12 years ago. I cannot remember the book, but I do have them on my bookshelf downstairs. That when Hitler came in power, Hitler sent 59 lawyers to New York and New Jersey to study how America had put the Native Americans on reservation. And they studied how Americans started Jim Crow law. And they went back and opened the concentration camps. Hitler brought 59 lawyers to America to study how we segregate people, discriminate it. And they applied what they learned from here, they applied to cause where they killed over 30 million Americans during the Second World War. 30 million Americans was killed under the hands of the German, the Italians, and the Japanese soldiers. They came to America and learned from us. How we made laws, how they studied our laws that we made to discriminate people. And now, you know, this is
yeah.
This is wild, absolutely. Man. I mean,
it's wild. Thank you.
So, I'm sorry. It makes me want to laugh.
It's part of what Astrid was sharing earlier, that you know, that was the part of the reason that her father was really pushing folks to understand the connections between American racism here and what the impact was of that learned space in Germany. But that's not just Germany, it's also South Africa, it's also other parts of the world who have imported that into this space. And that cycle that, you know, folks, it was sent here and it's gone back. So absolutely. I want to make sure that we get to the other spaces. Go ahead quickly.
But real quickly, you know, you brought South Africa. We brought one to, anybody heard that guy by the name Eli Musk? A South African racist nationalism who used the technology to hook the young people up on the technology, the racism, how he doing his cars, batteries in Africa. You know, how his grandfather and uncles had apartheid. He bring the same system to America now, how he do his industries. Okay, that's a different story, different time.
That's a good example, because that apartheid system is also part of what folks came to the US to learn to take back there. So I appreciate that, Abdallah. I'm going to move us forward to think about structural racism and how it takes root here and racial equity. So if we want to move to the next slide. Our friends, this is just a same definition, but kind of depicting all these different pieces and how they connect and work with each other. So if you think about it, that often when you run into some bad outcome in one of these systems, it impacts and has a kind of cascading effect on your outcomes in those other spaces. So for example, if you are someone who gets arrested and you happen to live in public housing, you might get kicked out of your housing. And if you're kicked out of your housing and you've lost your job, you don't have health care, and you may not be able to get a Pell Grant to go to college. These all have these cascading effects on each other. And part of why we really think about undoing structural racism is having to work at all of these spaces and having multiple hands, lots of people working in the spaces where they can take effect. And it's part of the reason why we ask you to think about what part of the elephant are you going to take a bite of, because we can eat that elephant together if we are working together. So we're going to dive a little bit deeper here. Our friends from the Racial Equity Institute help us to really think through, what does this really mean? How does this really work in American society? So they have something I'll recommend to y'all called the groundwater approach. You can Google it. We can provide a link as well to an article that just helps us to understand how racism is part of the groundwater. Their thesis is that if you see a fish in a lake and the fish is dead, you wonder what's wrong with the fish. If you see a lake that's full of dead fish, you wonder what's wrong with the lake. And if all the lakes have this same problem, you start to wonder what's going on with the groundwater. And that's what we're seeing in American racism and structural racism, is all these different places where we go, we have the same groups getting the same negative outcome. And so what's in the groundwater is the question. And they posit that racial inequities are really a product of the racial structured society that we live in, and that this was something that has been created in American society and persists. And so they put forward 3 observations. One, that racial inequity looks the same across different systems. So what we see in the judicial system, what we see in the education system, what we see in the healthcare system, what we see in the housing system is the same orientation, where certain groups are getting the bad outcomes and certain groups are getting the advantage. Socioeconomic differences does not explain racial inequity. So just adding money to or income to folks' life experience would not relieve their inequities. And what we also see is plenty of people of color who have money are also experiencing those same inequities. And last, that inequities are caused by systems, regardless of people's culture or behavior. So these are done by systems, not by people or their choices or their cultural connections or any of the things that often get blamed for why folks are experiencing the inequities that they're seeing. And positing these 3 is really about saying that we have a structural problem that's rooted in our history, and that we have to examine what that means for our society. So they have some demonstration of what that then looks like. If we go to the next slide. I won't take you through all of these, but basically African Americans have a multiple times more likely of a bad experience in all of these areas. So infant mortality, death from diabetes, suspension in school, incarceration rates, likely to be in foster care, less likely to get a loan. All these things persist, and that across the country, these things are the same. So nationally, if you go to the next slide, you'll see that nationally, that line is African Americans, and the red line is African Americans, and the black line is white. Never does the bad outcome for African Americans get less than the bad outcomes for whites, and it's also always a multiple thereof. This is nationally, and so one of the questions that gets asked, and most of us here are from Massachusetts, does liberal, blue, left-leaning Massachusetts do any better? And so we'll go to the next slide. And the answer is no. Also in Massachusetts, never do we get a place where African Americans and white Americans are at the same level, same likelihood of having a bad outcome. It's always a multiple, meaning 2, 3, up to 7 times more likely to have the bad outcome across these different areas. And that's, everything from childhood experiences or childhood obesity to the judicial system, child welfare system, and economic well-being, education, health. In all these spaces, African Americans are 2 to 7 times more likely to have a bad outcome. And so it forces us to really think about what is it that we need to address, and then what does this really look like? So we have a video that we're going to play for you that just kind of digs a little bit deeper. And when we come back, we're going to talk a little bit about like what's our ability to actually address this. So I'm going to stop here.
Born 400 years ago, when 12 million Africans were dehumanized and sold into slavery, and then continued with the terrorism of lynchings, the Tulsa Race Massacre, and Jim Crow segregation. And although the civil rights movement changed history by fighting for equality and justice, systemic racism, the kind that infiltrates institutions like banks, schools, and the law, is much more insidious. Let's look back and see how systemic racism became embedded in American society. Back in the 1930s, when Social Security was introduced, it excluded domestic and agricultural workers, and they accounted for 2/3 of Black Americans. This inequality forced many older Black Americans into poverty and homelessness. Between 1934 and 1962, the Federal Housing Authority underwrote $120 billion of home mortgages, and 98% of them went to white people. Federal policy said that Black neighborhoods were a bad risk and therefore not eligible for loans. Even the GI Bill excluded Black veterans from its beneficial housing provisions. Since then, house values have risen dramatically, giving white homeowners a huge bump in wealth from which Black people were excluded. Redlining was the system used by banks to determine which neighborhoods would get loans to buy homes. Black neighborhoods, outlined in red ink, were deemed the riskiest to invest in. Redlining made it impossible for Black people to get loans. Redlined areas also didn't have the tax base to fund good schools, healthcare systems, or transportation, causing safety concerns and subsequent over-policing, which seeded the problems we see today. Even now, predominantly white schools receive more than $20 billion more funding than districts that serve mostly students of color. And today, Black home ownership is at an all-time low, only 42% compared to 72% for whites. This generational history matters when we talk about the wealth gap, because inheritances are very significant to current wealth, and family wealth takes generations to build. In the U.S., white families hold 90% of the national wealth, Latino families hold 2.3%, and Black families hold 2.6%. Racial pay inequities widen the gap. This year, the average white worker made 30% more than the typical Black worker. With the whole family's income, Black households earn 60% of the average white household. Lower incomes mean that the poverty rate for Black families is over twice that of white families. Black individuals are also twice as likely to be unemployed than white individuals. And even though the number of Black college graduates is growing, they're twice as likely to be unemployed as all other graduates. One U.S. study found that job resumes with traditionally white-sounding names received 50% more callbacks than those with traditionally Black names. African Americans are still incarcerated at more than 5 times the rate of whites, even though imprisonment rates have fallen in the past few years. Black inmates make up over 30% of prisons, yet only 12% of the country's population. And even though African Americans and whites use drugs at similar rates, the imprisonment rate of African Americans for drug charges is almost 6 times that of whites. Black Americans are more likely than white Americans to be arrested, and once arrested, they are more likely to be convicted, and once convicted, they are more likely to get lengthy prison sentences. Let's look at police stops. The Stanford University study analyzed more than 100 million traffic stops across America and found Black drivers are 20% more likely to be pulled over and more likely to be searched. In fact, in New York City, 88% of police stops in 2018 involved Black and Latino people, while 10% involved white people. Of those stops, 70% were completely innocent. A crisis like COVID highlights the inequalities in a society. Black people are dying of COVID at 3 times the rate of white people because of higher rates of underlying health conditions, higher density poor neighborhoods, more employed as frontline workers, and poorer access to testing and healthcare. So that's systemic racism. This awakening to injustice is our chance to make it right. Listen, learn, and act now.
Thank you, Paula.
Hello, my name.
Not sure who that guy is. But if we go to the next slide, I'm sure that there was nothing too surprising there, but if folks heard anything that was like, oh, I didn't know that, or something was surprising, and then what if anything resonated with you? And I want to see if we can get some voices of folks we haven't heard from before. And yeah, we'll share the link to the video with the PDF. Abdullah, thank you for that question. And here's there's the link there. Folks, any reactions to the video? Anything that came up for you as you were watching that? Anything resonate with you? Who haven't we heard from today? Whitney, what do you think?
Get the chat, Mo.
Oh, I've seen in the chat, Jessica, new learning for me, domestic and agricultural workers were excluded from Social Security. Yeah, so still many jobs were excluded from what you would get as Social Security. I believe that agricultural workers who are in certain situations are now included, but I have to look that up. The other truth that we don't ever tell ourselves is the balance of agricultural workers are not even on a payroll system, so they wouldn't be able to get Social Security. And then the folks who are undocumented, which are a huge number of agricultural workers, are really outside of the work. So they're contributing. Often they're using paperwork that pays taxes into the system that they'll never actually get. So there's another entirely system of taking in money there that never gets paid out to folks. Other folks, anything else that jumped out at you? Any reactions or any connections that you're making to what you saw? Yeah. Thank you, Hilda, for that. Part of the dynamic in the United States and part of what our friends from racial equity point out is that black-white dynamic is the basis for the discriminatory practices and the racism that we see with BIPOC folks across the board. And often it's the more discernible features of that racism, but certainly our Latinx brothers and sisters and our Asian and Hawaiian brothers and sisters, and certainly our Native American First Nation folks are having similar impacts as well. Any other reactions? Anything else from the video that jumped out at you? Right. If we can go to the next slide. We've talked a little bit about racial equity, but one way to think about it is we reach racial equity when race is no longer a predictor of negative outcome. In the US, still typically race is a predictor that you are more likely to have a negative outcome from any systems that you're engaging with. We also hear racial justice come up a lot as we define it as a proactive reinforcement of policies, practices, and attitudes and actions that produce equitable power, access, opportunities, treatment, impacts, and outcomes for all. So our friends at Race Forward who put forward that definition, I really like it because it breaks out that we're not just looking for access and opportunities, but actually the power and having decision-making power within that, and that those systems provide good outcomes for everybody. Next slide. We wanted to just posit where are we in the historical context. Our friends at Human Impact Partners have some really good slides that help us to kind of see where we are and really thinking about like what has happened in this country, what were the dynamics around creating the imbalances that we see with race. So from about 1492, it looks like, to 1619, as the era of colonialism gets started, the genocide of the First Nation folks. There's a study that puts it at like 94% of the Native American population was wiped out before the Pilgrims got to Plymouth Rock in the 1600s. And that really means that, you know, what they found, and the Pilgrims write about this first person, they're like, oh, wow, the corn and the squash there, they grow in rows. Well, that's someone's farm that was there that died off before you got there. And so some of these things we're starting to better understand now about what was actually going on there. About 400 years ago also is the beginning of the chattel slavery of African Americans into the United States. And so we see that era starting in about 1619. Some folks posited that it might have been a little bit before that. But that there are folks here in the United States who were being commoditized for the purposes of building the country, and that slave industry also helped build the country. So if you've been in Massachusetts and you've been to like Faneuil Hall, or you've been to Winthrop, or you've been to Maverick, a lot of the names that we have that name the places that we're familiar with, especially in the Boston area, come from slave owners and slave owning families that helped build those societies, but did it on the back of the slave trade, whether they were building ships or doing the actual commercial slavery themselves, or owned plantations in other parts of the world. That's part of our history, and sometimes we localize this down south, but really it's a part of American history and the American dominance in the economic system. By 1860s, we get to the Emancipation Proclamation, and Reconstruction gets us into Jim Crow laws. We had this blip, a moment where equality started to begin to take shape, and then a real quick backlash at the end of Reconstruction, and many of the things that we associate with the laws that create structural racism come from this era. And then at the height of the Civil Rights era, we have the Civil Rights era, we have the Civil Rights Act, and while there have been sustainable kind of impacts while there's been a kind of a movement to change a lot of the laws and so forth that we see there, there's still quite a bit of structural racism that's in place there. So if we go to the next slide, what we see in this era is the mass incarceration of Black folks, white flight and de facto segregation, theft, abuse of indigenous land and neighborhood and destruction, disinvestment, and what folks call gentrification that we often talk about as dislocation. And that this has been going on for, now up to, say 60 to 70 years. I live in Newton, which most folks do not see as a Black community. There's an African-American community in Newton that's been there for 150 years, but 2/3 of it was wiped out when the Mass Pike was put in, and they literally removed that neighborhood and the people who live there to put the Mass Pike to go through that part of Newton. And so what remains is the historic church that was there and the few families that were able to hang on to their properties, but it wiped out that era. We are in some ways more segregated in places than we were before, but this segregation has taken shape in many places. I'm going to show you some maps there to just give us a sense of how that has worked. We're going to move forward. This is a red line map of the Boston area. We could show other parts of Massachusetts. There aren't red line maps for everywhere, but this shows like the greater Boston area. On the next slide, we make it a little bit bigger so you can kind of take a good look. Go to the next slide. So that area that's marked in red is the part that was redlined. This is the areas that had the greatest concentrations of people of color and the areas that were disinvested in, meaning that banks were not allowed to make loans to African Americans who lived in those spaces. And so basically by policy, we have concentrated disinvestment and poverty into those spaces. I grew up in this little red speck here at the top where Cambridge is, right there in the port, as also as a redlined area. And I didn't understand why it is that we had two housing developments that were built at the same time right next to each other. And later on, I'll reference a book, The Color of Law, where Richard Rothstein in there points out that, oh, they built those because one project was made for white people and one project was made for Black folks and other people of color, even though they are separated by a one-lane street that runs one block. That's the history that was being created in segregation and discrimination that was being created there. What it results in is spaces that were made and allowed to be mainly for white folks and places where people of color were concentrated into. And that's a part I want to make sure we get across. This isn't a choice. You know, we often hear people choose to live with people just like them. My family, my wife's family is Chinese and have long been a part of the Chinatown community. That wasn't a choice. They actually could not own businesses and build out their businesses in other places. They could have like one restaurant somewhere else in the city that wouldn't allow them to live there. And so the Asian community, like many other communities, have been forced into narrow sets of spaces. So if you're in a community that has historically been majority white, it also has historically been a space that wasn't open to people of color living there. That's one of the things that we struggle with, the, you know, denoting that advantage was given and that that advantage continues, because those spaces only now are beginning to be a little bit less less segregated. So I'm going to show you an example of what that means. This is the 1940s. This is 1980. So that strip of blue and green are the spaces that there are more African Americans. All of the red that you see and the orange are spaces where there are less African Americans. And if you can tell by the slide, those big areas of red are spaces where there is less than 1% African Americans. All that red that you see there are communities that are less than 1% African Americans. When I first saw this slide, I was like, really? And then I remembered, because I was around in 1980. I know, Astrid, you're going to claim that you were alive in 1980 also. No one believes you. And there were places that I couldn't go. When I came to work at HRIA 25 years ago, I was sent to Charlestown to go do a workshop. And it was like the first time I had been there professionally or spent any amount of time. I was there for 2.5 hours. That was the most time I had ever been to Charlestown, because growing up, that wasn't a place I could go. Same thing with Southie in South Boston. Same thing with Quincy back in the day. There are lots of these places that were much more segregated than what we remember them to be today. And there were little pockets that were a little less so. So there's a little dot of yellow that's in the western part of Medford. And it's just, if you look at where Somerville is, it's kind of the part that's a little bit further there. That was the one place that African Americans from Cambridge, when they made it, could move to. If you notice the areas that are in this map, mostly red and yellow, red and orange, they were spaces that either for a long time historically didn't have people of color, or kind of de facto or de jure at some points had laws and other segregation policies that kept people of color from living there. Our friends in Beverly are examining now the racial covenants that kept people of color out of that community for over 100 years. Part of what we have to kind of struggle with is what's been the implications of these kinds of laws. So go to the next slide. This is 2013, so you see that there's been quite a dispersal of Black folks in that interior part. So there's very few places that have that dark blue anymore, almost none there, where it was like 98% African American. And then you see more of the light colors going into those other spaces, but we're still in the, red, orange, and light orange in most of the other spaces. Everett, which is at the top of your map, right under the 13, is now the community with the largest percentage of African Americans in the state, at something like 20-something%, mainly of Caribbean and Haitian descent. These things persist, and they are powerfully a part of how we see our communities and what the opportunities are in our communities and who gets to do what. And this is what we want to investigate as we move forward. If you go to the next slide. These are some of the interweaving social and governmental policies that created the segregation that we saw. So actual laws against forcing segregation, unwritten laws forcing segregation. When I was a kid growing up in Cambridge, there were the tracks that segmented East Cambridge were the places you couldn't go as a person of color after 5 p.m. Like you could go and shop there, but then you had to leave. There was an Asian family that moved into the neighborhood, and they burned down the building that they had moved into to reinforce those unwritten laws of segregation. Race riots up until the 1966, race riots were almost exclusively white mobs going around killing people all over the country. That's the history of race riots before the 60s. We have this perception of race riots as African Americans acting out on their frustrations of injustice, but that's very recent. We have a long history of white racial terror in these different spaces. Racial covenants and redlining we looked at. The New Deal, U.S. Housing Authority, Federal Housing Policy, the GI Bill, if you saw in the video, these are all policies that acted against African Americans and other people of color in terms of what was available to them. Policies of urban renewal, as I talked about, like the Mass Pike. Often the highways that were built through communities of color, dispossessing people of their businesses and the land and homes that they had, with very little compensation, if any at all. Realtor associations and also were part of the problem because they were not showing people homes in certain communities. There's a guy I know who works for the judicial system in the state of Massachusetts, and when he was looking to buy a house, he was frustrated at he wasn't able to see houses in the communities he wanted to see, and he finally noticed that the houses were there were for sale signs. The realtors weren't showing him the houses that he wanted to go to, and this is in 2014, 2015. So these effects persist even still. There are lots of more of these. We will dig into these policies and others as we go into this next week, but I'm going to ask our friends here if we could go to the second to last slide. The second to last slide. Keep going, keep going, keep going. That one. Yeah, no, back one. All right. So we're going to use a democratic process to help us figure out what we want to focus on for next week. I'm going to ask you to vote in the chat. Which of these two areas would you like us to focus on? Which of these areas? You're going to pick two. So public health in general, we'll put that with health. So if you want to choose, it's between finance, housing, employment, education, criminal justice, government, and health. I'm going to ask you to put two in the chat. Which two do you want us to focus in on? And next week, we're going to look at policy systems and environmental change. We're going to dig into a couple of these spaces and also start to help you think about where is it that you might be able to act in your local space. So I'll ask folks to, again, just vote in the chat. Which two do you want to focus on? keep going. We're gonna take the count afterwards, so we'll be able to know exactly how many votes we got for all. Just save the chat too. So just want to give folks a chance to continue to vote. And we're going to use the process, the Massachusetts process. Sorry for the folks who are not here, that are here from other states. In Massachusetts, we get like one person gets one vote. I know that that's new for folks from some other places, but we just ask folks to vote once here. One person, then you get to vote for 2 spaces. That's a joke. I know it's a little over the top there. So if you haven't had a chance, please vote for the 2 that you would like to see us focus on. And again, we'll be diving deep into those 2 and policy systems and environmental change with some examples of what folks are doing around the country in spaces like yours, and also helping you to think about what you might do from your position, your vantage point, and in the work that you're doing at your local level. So if everyone has had a chance to vote, I'm going to pass it to Paula, who I think is going to close us out for today. Unless, Lauren, you want to say something before it goes to Paula?
No, hand it over.
All right. Paula, I'm going to hand it to you.
Thanks, Mo. So thank you everyone, first of all, for being here, for being present, being engaged. This was a super collaborative and participative group. So I appreciate all of your high energies in this process, in this learning process. Also want to thank, of course, Mo and Lauren for being amazing presenters and just sharing all of your knowledge and experience with this group. Also a shout out to Victoria for running tech on this, and Daisy for introducing this space. And just want to plug that we do have the part 2 on April 11th. So that is, I don't think it's next week. Is that like, yeah, it is next Thursday. There we go. From 10 to 1 p.m. Eastern time. So, be back here next Thursday, and we're looking forward to seeing you again. Thank you for sending in those votes in the chat, by the way.
Thank you, Paula. I'm just going to close it out and say if there's any last comments or anything else that you want to say, please take the floor, or you can put it in the chat. Really appreciate folks hanging in and hanging tough with us for the whole session. I look forward to seeing y'all next time.
Thanks, everyone.